Today we're going to learn about sunken eyes. In English it's also called sunken eyelid, and actor Lee Dong-wook is well known for having sunken eyes. When the area above the eyes is deeply hollowed, we usually refer to that as sunken eyes. So today I'll talk about 3 ways to address sunken eyes. But first we need to look into the causes of sunken eyes. There are mainly 3 causes which I'll explain now. The first is when the upper eyelid itself lacks volume. So if you naturally have little orbital fat here, or if your skin is very thin and you have less of other tissues, this area will become sunken. In addition, some people have facial bone structures and eye shapes where this area is naturally set deeper. So there are people who not only lack volume, but also have a structure that makes this area more prone to sinking. Secondly, people with poor eye shape, that is, those with weak eyelid lifting muscles, or in more severe cases, those with ptosis, can also experience this. When the eyelid lifting strength is weak, the eyelids don't rise properly and the eyes look half open, which makes the area above here appear more sunken. If you have poor eye shape, there's a possibility that your eyes may look sunken like this. That's how you should see it. Lastly, the third case is when too much fat was removed from above the eyes during a previous surgery. Naturally, even if there was originally a lot of fat here, if too much is removed, this area will end up looking sunken. Or sometimes after surgery, the eye shape actually worsens, or due to the sausage phenomenon, the eyes open less, making this area look even more sunken. So, if this condition was caused by a previous surgery, you can say there are mainly these 3 cases. Now, there are also 3 main ways to address these sunken eyes. First, the first method is called orbital fat repositioning. If you look from the side, you can see that there is orbital fat above the eyeball. Quite a few people have this orbital fat rolled up and tucked inward toward the upper inside area. While there may be a slight lack of fat itself, the main issue is that the position of the fat is not quite right. If the fat is pushed up too high, it ends up tucked inside and can't properly fill the sunken area of the eyelid. In such cases, if you pull the orbital fat downward and reposition it, you can significantly improve the appearance of hollow eyes. Next, the second method is eyelid correction. In a way, this would apply to this case, right? Eyelid correction, which can also be referred to as ptosis correction. If you improve the ability to open the eyes, the upper eyelid lifts up properly, bringing forward the volume in the sunken area and making the eyes look fuller. This eyelid correction can be considered the second method. The third and last method is actually the one that many people are most familiar with. It's simply grafting fat directly onto the upper eyelid. Fat grafting to the upper eyelid. Since there's a lack of volume, you just add fat. That's the basic idea. Usually fat is harvested from the thigh or abdomen and then injected into the sunken area above the eyes. When double eyelid surgery is performed together with eye surgery, methods 1 and 2 are usually done together. Sometimes fat grafting to the upper eyelid is also performed in addition to these procedures. Alternatively, sometimes only the upper eyelid fat grafting is performed alone. So, it's not very common to do just one of these 3 procedures. Personally, I think the best results come from combining these 3 methods to some extent. However, one thing I want to mention here is that there seems to be a trend these days of performing upper eyelid fat grafting alone too often. Of course, upper eyelid fat grafting can be very effective when done for the right candidates, but there are people whose eyes lack definition. So, if you perform upper eyelid fat grafting unconditionally on people with weak eyelid opening muscles, sometimes their eyelid opening strength can become even weaker, making them look sleepier and more tired, and causing the area to look awkwardly puffy. In fact, it's extremely important to thoroughly assess the condition before surgery. You need to figure out what the eyelid shape is like and what the actual cause is. If you keep doing only upper eyelid fat grafting, there are cases where the eyelid opening muscle becomes even weaker. And sometimes when this area becomes too puffy, we end up removing the fat and reinforcing the eyelid opening strength. When performing upper eyelid fat grafting, it's crucial to place the fat in the right position. If the fat is placed above the eyelid opening muscle, it makes surgery much more difficult. I strongly recommend that you thoroughly discuss your condition with your doctor, get an accurate diagnosis, and proceed with the best solution recommended to you.